Hi, this is your Royal Health Emergency Room. How can I help you? I believe my husband having a stroke. What should I do? Well, this is a Royal Health setting, ma'am. And in a Royal Health setting, we don't have a true stroke center. I'll send an ambulance. They're on their way. Thank you. The description of the problem. The problem is the management of the acute stroke patient in the Royal Health setting. And this problem is significant in the Royal Health setting, and I will present some facts. It's a major problem with the management of stroke patient in rural areas. It's a major challenge. Implementation of stroke units require multidisciplinary stroke expertise, which may not be sufficient enough in many often rural areas. Thereby delivering appropriate stroke care in such regions is a major health. To meet this demand, we must develop stroke units or have one center that is the expert in stroke management and use telemedicine to assist in the management of these patients. Studies have shown that this does improve patient care and it does improve outcome. Here's what is known about the problem. Of the 5.7 million stroke deaths in 2005, 87% occurred in low and middle income class, where 80% of people live in rural areas. The same study reviewed the urban-rural differences in stroke incidence and prevalence. The results showed that stroke was 1.45% more prevalent in rural areas. Using telemedicine, teleneurology to improve the stroke care in rural health settings could contribute as much as 75% in the case concerning diagnostic workup, CT assessment, and therapeutic recommendations. In many of the same studies reviewed, the overall improvement in stroke management and decision-making were vast. The benefits of using telemedicine allows the first line provider a direct line to a neurological expert. This can be accomplished through telephone, consultation, or video conference. It's very similar to the concept of phoning a friend. Hospitals will benefit by having specialized in treatment of one of the most frequent and devastating disease. Time is the biggest factor in management of stroke. American Heart Association equates times to brain cells, meaning for every minute this patient is without clot-busting technology, therapy, brain cells are dying. To receive this therapy, the patient must be a good candidate. The clot-busting therapy comes with certain risks, such as people can bleed to death, so MRIs need to be obtained. Before therapy is given, certain tests must be done, such as head CT, IVs will need to be placed, and lab charts drawn. This information is gathered and given to neurologists to decide the best course of action. Having a system in place, such as telescopes, solve this problem and decrease time for treatment. From the moment the patient is in the emergency room, to give or administer TPA is 60 minutes. On average, there are 300 strokes per 100,000. So a rural hospital setting may only see a limited number of patients. This further complicate matters, surgery or no surgery. The results showed that after the first 3 months, 44% of patients admitted using telemedicine and 54% managed without telemedicine had poor outcomes. Also, the findings indicate that using such systems as advanced practice nurses can help in the rural health settings. These therapies, after a review of professional literature, shows that they were ineffective when there was lack of access to devices such as video conferencing, or there was a delay in care. So to further appropriate these studies, the utilization of apps should be used. When collaborations occurs, outcomes are also improved. Innovation requires collaborations with a different, diverse group. In this setting, the nutritionists, the neurologists, the ER doctors all collaborate. Lack of collaboration could result in poor outcomes. One study shows that patients greater than the age of 80 years of age have poor prognosis from ischemic stroke and an increased risk of hemorrhagic complications from the TPA. During my proposal, my first collaborator was Dr. O'Bailey, the chief neurologist. He was chosen because of his years of experience and his expertise in the management of stroke patients. Dr. Bailey believes that technology is an integral part of the management of acute stroke in the Inland Empire. He emphasized the need for a consistent and available neurology provider. He felt that this be met using an app that managed robots. He currently uses the RPVITA app created by a neurologist. It's the voice of our RP app. Dr. O'Bailey states that 80% of strokes are preventable, and this app allows the staff to know when to use the TPA, and it could be crucial in the first 3 hours of a stroke. He states that the use of this app is around $5,000 per month. The next collaborator that was chosen is a nurse practitioner that's assisting the management of stroke patients. She spoke about the innovation that this app provides, and she mentioned that she's been in practice for the last 6 years. She states that the small application enables teams, interdisciplinary teams, to act at its highest efficiency and capabilities. This collaborator was chosen because she is the bedside mediator assisting in the management of the acute stroke patient. She acts as the hand of the neurologist during the interview of the patient and assists in the direct patient care. The final collaborator that was chosen was the patient himself. This patient was able to give a first-hand account of the stroke recovery and survival as a result of this technology. The patient states that he is a witness in the benefits of using this technology. He's alive today because of it. This RP Vita app was created by neurologists and operates using voice over IP technology to assess the patient. This is considered a game changer as it allows neurologists to assess patients remotely. This app allows collaboration between ER team and neurologists and increased survival rates. The RP Vita app costs approximately $5,000 per month, and it utilizes a robot with a screen that has the neurologist's head. The neurologist asks questions using the RP Vita app and assess the patient and decides appropriate treatment plans. The collaboration of the nurse practitioner and the neurologist utilizing the RP Vita app is very forward-thinking. With the robotic intervention, it allows the assisting life-saving method. The lack of neurologists available in off hours can be justified with this app. This technology is innovative because the innovative technology and team collaboration provided evidence for advancement in the management of stroke patient. Every encounter with a stroke patient and staff are opportunities to use this technology and create learning experience. Exposure to innovation within across professional groups will serve to assist in the deterioration of barriers. Shifting paradigms in the provision of care is an excellent way to step in the intersection. The interdisciplinary team and patient come from the contracts and background experiences. This provides a unique way to learn and experience a daily professional practice differently. Testing of limits offer a potential for discovery of previously unknown solutions. In order to do so, assumptions must be challenged. Studies on the benefit of telemedicine in the field of neurology shows great promise, as is there with this particular interview group, and the benefits are valued. Tying innovation, technology, and collaboration together helps us come up with a solution to solve this puzzle. This puzzle assists in the management of the acute stroke patient, and the use of this app, RP Vita, will assist and improve patient outcome. Thank you for listening.